Hi, everyone. Welcome to Facebook Live. I'm Kara Sundlin, and we're talking about those injuries, specifically shoulder injuries so many people are suffering with. Orthopedic Surgical Partners is really dedicated to superior care right here in Connecticut. And I'm happy to introduce Dr. Michael Boniello. And he is here so that we can ask you some questions, see what we should be doing, and all of that. So thank you so much for being with us.
Thank you. Happy to be here.
What's one of the most common shoulder injuries that you see a lot of?
We see, obviously a lot of fractures, but not even injuries as much as people just coming in with just shoulder pain. They don't know.
Pain.
Yeah, they don't know. Some people say, oh, I just woke up with it. I turned over in bed and boom, they have some random shoulder pain.
Yeah. So is there a most common cause when people come in saying, I don't know, doc, this just hurts?
Yeah, some of them can be just an overuse. Obviously, in the absence of major tears or anything like that. If they, just kind of just overusing it at their job, overusing it in sports or whatever. It could be from kind of malpositioning of the shoulder in certain ways, but it's something that they kind of just find that one day they wake up and they just have it. They don't know where it came from.
Okay. And then you said that some people need to know about management for bursitis. What's that?
Correct. Yeah. So that tends to be the underlying cause for random shoulder pains. Bursitis is inflammation of a certain area of the shoulder, and pretty much a little bursal. It's a little pillow that overlies the rotator cuff, and it can get inflamed and irritated, and that's what bursitis is: irritation of the bursal sac over the rotator cuff.
And what do you do for that?
Well, physical therapy can be pretty helpful for that.
Okay.
And if physical therapy doesn't help, then we could inject the shoulder, kind of get that inflammation down chemically with injections like steroids. Yeah. But we're pretty successful at treating that. Pretty successful at getting that away
without surgery.
Correct, without surgery. And people, when they come in with pretty painful shoulder and then it goes away and we're able to do it without surgery, they're pretty happy.
So if you're just joining us, we're live here with Dr. Michael Boniello from Orthopedic Surgical Partners, and we're talking about shoulder pain because it's so common for a lot of folks. So a lot of people might be fearful to go to an orthopedic surgeon thinking, I don't want surgery, but in fact, you often do so many other things before you even think of an operation.
Oh yeah, absolutely. As great as surgeries are for many things, non-surgical treatment is our first line of treatment for everybody. And if we could save somebody a surgery, and we say this all the time, that's the best case scenario. Absolutely.
So what about those rotator cuff tears? I know that I hear so many people have suffered with those. My father had one. They're just really common?
They are very common. They're more common as we age too. It's a little piece of tissue that essentially helps you move the shoulder. It's attached to a muscle, and in time the blood flow just kind of weakens to the area, and ultimately it could kind of tear in time, or if you fall and you dislocate the shoulder, you could tear the rotator cuff off traumatically, which is not as good.
Okay, so can you treat that without surgery?
We very much can. Yeah, a lot of studies have shown that treatment of smaller rotator cuff tears can be very successful. The smaller they are, more it's just kind of pain as opposed to functional limitations. But the bigger they get, you get more weakness and dysfunction of the shoulder that way.
Okay, so the other thing is management for arthritis, and arthritis, is it? There's all these rumors, right? I tell my kids, don't crack your fingers, you'll have arthritis. The doctors say that's probably not true. But how do we get arthritis in our shoulders?
Yeah, so it's interesting. And yes, cracking your shoulders, cracking your knuckles and stuff does not cause arthritis.
It does not? Okay, I'm not going to tell my kids that. I don't want to hear it again.
But people can get arthritis all over the body. It's essentially wearing away of lining of the joints that allows you to move different joints with low friction.
Okay.
But the hips and knees are weight-bearing joints. The shoulder is not, so it's actually much more rare to get arthritis in the shoulder of the ball and socket. But some people genetically just get it, or from previous sports injuries. If you dislocate your shoulder, multiple times, that could cause arthritis of that joint as well.
And so you do something called cartilage restoration. Is that for arthritis, or what's that for?
Yeah. So that is currently it's more approved in the knee joint. It's something that I was trained pretty extensively in my fellowship. For when people have focal or singular loss of cartilage, if they have like a big pothole in their knee. Pediatric patients can get it all the way up to just active sports patients. Previous treatments for it weren't very good. You just have to kind of deal with the pain of it, or use cadaveric parts to essentially fill that pothole. But newer techniques are coming out that we're able to actually use the patient's own cartilage and fill in the pothole with a bunch of different techniques. Pretty cool.
Okay, so there's also you have anything from bone fractures. I mean, those of us who have kids playing sports, we were talking about my son and his football adventures right before we started. But if you hear something go snap, crackle, pop, anything like that, a lot of people just kind of go, oh, I don't know what to do. Is the better idea? Would you tell people we should go see someone like an orthopedic? Just go to OSP, go to a walk-in, check it out before we find out if we need something.
Yeah, I'd say so, because I mean, so the body is fantastic at telling us if something is wrong. If you have a lot of pain with something, maybe something's broken. But even the little, random snap, crackle, pops are pretty, unsettling to people. And they come in and say, hey doc, I do this with my shoulder and I feel this popping back and forth. We could confirm or deny that there's something going on. It's nice to have the ability to check that, to just walk in and say, hey, peace of mind, everything's okay, or hey, something is needed for this.
Does, those people who are kind of on the fringe of needing something, is there anything that helps? Like, should you always be wearing an ACE bandage around your bad joint, or sleeping a certain way, taking certain supplements? Is there anything that we can kind of do for prevention?
Yeah, it's a fantastic question. I think that there's a lot of studies going into every single one of those. I think one of the best things, me being a sports medicine surgeon, we look into prevention of sports injuries, because they're just so prevalent, and the prevalence of them are skyrocketing. It's really just in a very structured way, warming up before sports, not going into sports cold.
Okay. Warming up, super. Even for those of us who are working out, we shouldn't skip our warm-ups.
Very much so. Yeah.
How long do we need to do it, and what type of warm-up?
There's different types of warm-ups, different types of things, and just kind of an interesting thing specific to ACLs. There was a study done showing a specific type of neuromuscular warming up before sports, and they studied in Division I female collegiate athletes, and showed that warming up with a very specific protocol actually decreased their ACL tear rate by north of 95%, which is incredible.
Okay, so anything like, just for the rest of us, like just kind of walk on the treadmill a little, or is it better to do like up and down squats to warm up? Is it better to do like some cardio, or is it better to do more weight-bearing stuff slowly to warm up? Yeah,
kind of weight-bearing things. I mean, cardio is always good, but just making sure the muscles and everything are warm before. Stretching is good. Stretching is better after activities. But
I've heard that we can stretch before, but it's more effective after.
Correct. Yeah, just kind of warming up weights, or just cardio, whatever. But warming up versus stretching. Okay,
so make sure don't work out cold. Go slow, warm up, and
correct.
Okay, is there about like 5 minutes? Is that enough? Or?
Oh, I don't know as much about the time.
Okay, all right. See, I'm asking. It's okay. You can tell me you don't know.
It's good.
The important thing to take away, and I know there's a lot of people who just ran the marathon last week, and they're probably still a little sore, but just making sure we're warming up and all of that. Anything else that you really want folks to know out there?
Yeah, I mean, for pretty much any pain that they may, undergo, and we kind of touched on this before, people don't need to tough things out, and I think it's good to know that for our orthopedic urgent care, you can just kind of walk in, and, for things that have been going on for 5 minutes or, 15 years, we can evaluate with x-rays pretty quickly, and I think it's a good peace of mind to know that.
Yes, and you have your own experience. You were an alpine racer. You did lots of construction work with your dad. So did you have some injuries, and that's why you do what you do?
Luckily, no. Okay. Knock on wood. But I competed in alpine racing, and we work with some ski racers and everything, and it's something that's near and dear to my heart, and that kind of got me into the sports medicine aspect to it. But just orthopedics is so mechanical. Me growing up with my dad, working on, carpentry and stuff. As advanced and as wonderful as our field is, it's a lot of carpentry.
So you're fixing people.
Absolutely.
Put us back together.
Absolutely.
Can you still fix the furniture?
I can.
Yeah. Okay, that's good. See? So anyway, you can actually go see Dr. Boniello. He's at Orthopedic Surgical Partners, and you've got offices in several places in Connecticut that could be convenient to us. I know right here in Rocky Hill, and then some other locations too as well.
Yep, we have Manchester, we have Avon, and in Rocky Hill are our urgent care locations, and we also have a satellite office in Willimantic.
In Willimantic. Okay, so for more information, you can visit ospct.com. You can also give them a call. It's 860-525-4469. We're putting on the screen right now. So again, Rocky Hill, Manchester, Avon, Willimantic. People might think, oh, I can't get into the doctor. You even have, like you said, walk-ins. So just go, get it checked out. You'll know what you need to do. Don't guess. Don't just do Dr. Google, right?
Exactly.
All right. Doctor, thank you so much. We'll talk to you about fixing some chairs a little later.
Yeah, I'm happy to help.
Just kidding. All right. Have a great day, everyone.